Imagine a world where surgeons can step into virtual operating room to rehearse complex procedures. Medical students can explore 3D anatomical models with a wave of their hand, and patients can better understand their own conditions through immersive experiences. In a rapidly evolving world of healthcare, where innovation meets precision, we delve into the realm of augmented and virtual reality in surgery. Today's agenda: abstraction, introduction, AR and VR in healthcare, AR and VR in learning environments, use cases in procedure planning and perioperative contexts, AR in surgical theatre, influence on telehealth and remote surgery, limitations and constraints, conclusion, and references. Abstract. Augmented and virtual reality are revolutionizing healthcare by enabling the intuitive exploration of digital medical data and integrating it into the physical world. These technologies utilize lightweight head mounted displays to immerse users in realistic 3D digital environments, enhancing the interaction between healthcare professionals and patients. AR or VR in healthcare offers benefits like improved access to information, enhanced spatial awareness, and cognitive support. It finds applications in surgery, learning environments, procedure planning, and perioperative contexts. Introduction. In the future, hospitals will seamlessly integrate digital health information into clinical practice, replacing paper based records with automated, patient specific approaches. Augmented reality and virtual reality technologies are rapidly advancing and have the potential to transform healthcare by breaking down barriers between the real and digital worlds. AR overlays digital content into the physical world, while VR creates a fully immersive virtual environment. Both technologies utilize stereoscopic displays for depth perception and various interaction methods. They enable real time integration, visualization, and interaction with healthcare information, improving user focus and enhancing healthcare outcomes. AR and VR in healthcare. AR and VR are immersive technologies that use digital displays for presenting computer generated content, featuring head tracking for natural exploration and interaction. AR overlays digital content into the real world, allowing both real and virtual environments to be visible simultaneously, while VR provides a fully immersive experience by completely blocking the real world. These technologies, equipped with stereoscopic displays and various interaction methods, have significant potential in healthcare, enhancing real time integration, visualization, and interaction with medical information. They find applications in surgery, education, treatment planning, and patient care, ultimately improving outcomes and decentralizing expertise in health. The figure illustrates an application of AR in an operating theatre in the hospital of the future. The surgeon wears a lightweight AR headset which overlays 3D digital imagery on the physical world. This enables the ability to completely replace traditional 2D computer displays with floating adjustable, holographic representation of the patient's vital statistics and even enables the overlay of 3D internal anatomy. AR and VR in learning environments. AR and VR revolutionize medical education by enabling engaging and interactive learning experiences. They support basic science education, scenario based learning, crisis management, and clinical case examination, providing distributed and engaging teaching methods. Surgical trainees face limitation in gaining sufficient clinical exposure and operative experience during working hours. AR and VR can bridge this gap by facilitating rapid skill acquisition, allowing trainees to practice in realistic and risk-free environment. AR and VR in learning environments. As the global population grows, there is an increasing demand for surgical training. AR and VR offer scalable and flexible teaching methods that can be deployed where needed. These technologies complement traditional teaching approaches, reduce costs associated with cadaver dissection, and enhance the training experience. Learning is most effective when it occurs in the context where the knowledge will be applied. AR and VR support situated learning by providing contextual information, enabling better recall of specific tasks when they are performed later. VR based surgical training has been shown to be efficient and convenient. Users develop technical skills comparable to traditional training methods while also improving non technical skills and self confidence. Integration of AR and VR in surgical education enhances both teaching and learning experiences. It also opens up opportunities for remote teaching, participation, and collaboration among medical professionals. AR and VR are transforming surgical training and medical education by offering immersive, context rich, and flexible learning experiences that address the challenges of limited clinic exposure and skill development in rapidly growing healthcare landscape. The figure shows four different scenarios. First, A, wireless broadcasting of reality or mixed reality headset first person view video stream for shared anatomic visualization during central venous line training. B shows VR training application of 3D model of surgical tool and anatomy during a VATS lobectomy test. C shows a VR application of the integration with 3D models of the maxillofacial anatomy to improve medical trainees' self-confidence. And D shows a Silverchain envisioned the use of the Microsoft HoloLens for virtual hospital services in 2017. Here, a doctor is projected as a hologram via the headset worn by the patient. Use cases in procedure planning and perioperative contexts. AR and VR enable detailed pre-planning of medical procedures by integrating patient-specific data and providing lifelike 3D views. Surgeons can better identify potential complications, rehearse complex procedures, and collaborate with colleagues for improved surgical outcomes. Surgeons typically work with 2D digital information, which requires them to mentally reconstruct 3D scenarios. AR and VR help by providing a 3D visualization of medical imaging data like CT scans and MRI, aiding in diagnostic and treatment planning. They are especially valuable for surgical planning and simulation. Knowledge retention is crucial in healthcare. AR and VR assist healthcare professionals in assessing explicit memories associated with specific case histories and developing implicit skills through muscle memory. This ensures that they can perform procedures more effectively and recall critical information when needed. AR and VR also benefit patient communication by providing orientation to hospital settings and 3D models with patient specific data. Patients can better understand complex procedures, reducing anxiety and improving the overall patient experience. VR has shown promise in reducing stress levels by preoperative patients. The figure shown or is shown with three different scenarios A, B, and C. Origins of AR and the screenshot is of Kruger's 1983 video plays. The participant's image is digitized to create a silhouette. Procedures analyze the image posture and its relationship to other geographic or graphic objects in the system. Here the user is typing a sentence by selecting letters displayed at the top of the screen. B shows detecting and marking feeder veins with the vein viewer prototype. And the C shows application. AR has applications for overlaying real-time 3D internal anatomy in place over the patient. AR in the surgical theatre. Surgeons are increasingly interested in implementing augmented reality in surgery, leading to improved safety and efficacy, especially in orthopedic, neurosurgery, head and brain, hepatobiliary, and pancreatic surgery. AR allows for the projection of CT, MRI, or ultrasound scans into the patient's body, aiding orientation, anatomical delineation, and surgical approach planning. AR devices like the Microsoft HoloLens have been used for extremity reconstruction surgery, reducing anesthesia time and morbidity, improving training, and enabling remote support. Superimposing patient anatomy and receiving real-time feedback from colleagues during surgery enhances safety and outcomes, as demonstrated in shoulder replacement surgeries. AR minimizes attention shifts away from the surgical field compared to traditional computer displays, improving attentiveness and reducing cognitive distance between data and the surgical task. AR and VR offer post-operative navigation capabilities by recording surgical procedures in 3D plus time data, enabling retrospective review and training through VR headset controlled playback. Influence on the telehealth and remote surgery. Traditional communication methods, example phone and text messages, have limitations in remote healthcare scenarios. Modern technologies such as smartphones and AR or VR enhances remote assessment and guidance in medical emergencies. AR technology like Microsoft HoloLens and Magic Leap 1 provides high definition video and real time 3D depth mapping for accurate situational assessment and remote communication. Real time remote consultations with medical experts become more effective through AR. This allows physicians to interact with 3D representations of patients and their medical data, improving visual caregiver instructions. AR combined with data communication networks, example 4G, 5G, Wi-Fi, enables remote patient situational assessment and guidance. First responders can wear AR headsets to receive visual guidance from the remote specialist, enhancing their situational awareness. AR and VR have significant impact on surgical education and remote procedural training, particularly in rural areas with limited access to healthcare. Modern AR headsets provide immersive telehealth capabilities, improving immersion, image quality, field of view, and integration of 3D imagery with the real world. Limitations and constraints. Surgeons may receive excessive information through AR during surgery, potentially leading to distraction or imprecision. Latency issues and misalignment of imaging data or annotations can be problematic. Solutions include displaying only essential data or providing methods to switch between information sets. Clinicians need assurance regarding the accuracy of images, especially in remote interventional guidance scenarios. Challenges include achieving discriminatory resolution between vital structures and ensuring no injury or pathology is missed. Challenges arises in rendering projections into the visual field, particularly concerning physical dexterity and precision in complex tasks. Innovations like light field rendering aim to improve depth perception and training effectiveness. Surgery involves a strong haptic element, and understanding the cognitive requirements for effective knowledge transfer and recall in an embodied manner is crucial. Haptic technology and embodied cognition research are ongoing. Positive social impacts of AR/VR headsets could be hindered by the absence of regulation, leading to uncertainty among users and legal challenges, including data privacy concerns. Conclusion: AR and VR bring unique advantages, including enhanced medical training, improved patient experience, the distribution of expertise, and streamlined medical procedures. They play a crucial role in the digitalization of hospitals. The integration of AR and VR with other advanced technologies in healthcare, such as AI and robotic surgery, promises a transformative impact. These technologies are poised to enhance accessibility, affordability, and effectiveness in healthcare, ultimately providing patients quality of life worldwide. These are the references for the report. Thank you.